you can get your Botox, you can get your teeth clean, and
There
you can
you
get
go.
diagnosed with herpes in the same day. I'm like, come on. Welcome to the Spit It Out podcast. This is where we ask the hard questions about life, dentistry, and healthcare. I'm Meg, a registered dental hygienist who loves to brush, floss, and spit out the truth. Good morning, Stephanie. How are you?
Good morning. I'm good.
Thanks for coming on today. I wanted to start with, tell me about your dental hygiene story. When did you first fall in love with dental hygiene?
So, fun fact, I am a first generation student. So, nobody in my family has ever gone to college. They never even went to elementary school. So, that being said, it was pretty hard trying to figure out what career path I was going to go into. I just knew that I had to choose something that was going to be financially stable and just have good job security. It's pretty much what my parents ingrained into me. So, I was like, what's better than healthcare? That is both of those. So along with that, I had a traumatic dental injury where both of my front teeth went straight up into my gums. I had fallen, went to the dentist because I couldn't see my two front teeth. They were gone. And they're like, oh my gosh, they're up there, but we can't take them out. We have to wait for them to come back out on their own. So I was like 9, 10 years old with no front teeth.
Oh my gosh.
Yeah, not fun. All the kids at school would be like, what the heck? But yeah, anyways, I spent a lot of time at the dental office because of that reason, and then had to go through ortho care twice. So always in and out of dental offices. But I always loved how welcoming everyone made me feel. It was just a nice place to go to. And at one of my orthodontic appointments, was the first time someone asked me, hey, have you had your teeth cleaned? And I was like, what do you mean? I brush them, I floss
Yeah.
them. Like, what else do I need?
Yeah.
And she's like, oh, we'll give you a certificate to like a food restaurant if you go get your teeth cleaned. And I'm like, oh, yes, I'm doing that. So that was my first like realization of what a dental hygienist is and what they do. I asked a ton of questions because I was so interested. And yeah, so my first dental appointment, they found like 5 cavities or something crazy like that. But yeah, that was my first introduction. And I knew that I wanted to become that little gap to help my family understand what it is to have dental knowledge. And that was my first kind of introduction on falling in love with dental hygiene.
How was your experience going through college as a first generation student?
Honestly, it was rough. They do provide advisors and stuff, but all of that's like a whole different language. You don't really understand what is English comp. What do you mean I have to have 20 credits to graduate? I didn't understand any of that. So I had to like self-teach myself everything. And I had no one to ask questions to. Because like I said, I was the first one in my family. I have 2 younger brothers. My parents don't know English.
Yeah.
And yeah, so it was tough.
What state are you based out of? And where did you go to school? Like what state?
Yeah, I'm in Kansas.
Oh, cool.
Lived in this little town named Emporia, so I went to school in Emporia for high school and hygiene school.
Oh, wow. That is so cool. So how long did you work clinically as a hygienist before considering going back to school?
So I worked for a total of 2 years before I went back to nursing school. And that was because I feel like I was also burnt out a little bit. When I first graduated hygiene school, I went straight into working. I started working Monday through Friday, typical work day, work week. But I worked at this office where they were making us work like 12-hour shifts. Yeah,
Wow.
12-hour shifts. We were expected to see a minimum of 12 patients, high of like 16. And we were seeing a lot of kids. And I think that's why our amount was that high.
Yeah.
But looking back, I'm like, I didn't know any better either. I'm like, I would have advocated for myself and said, no, I'm just doing 8 or just doing 10. But yeah,
Yeah.
I unfortunately didn't know the structure of what was normal, what was not normal.
Why didn't you temp around or change offices?
So I feel like I felt stuck. I was like, this is my first hygiene job. In school, they had ingrained to us, like, you have to stick at your job place for a year.
Oh,
in order for you to get good experience for other offices to want you.
okay.
So that was always in my head. I'm like, I have to stay here a year. I have to stay here a year. And I think I was just afraid because I had moved to Western Kansas and there really wasn't many options over there. And the only reason I went over there was because my husband lived over there.
Yeah.
And so we felt stuck. But then COVID happened. It was very awful, but also a blessing that made me open my eyes and be like, you know what? We can move. Like, let's get out of here. Why am I keeping myself here and being upset and sad, burnt out, tired? Like, let's just move. And so COVID was kind of like that push because we had been off of work for like 3 months without pay.
Oh my gosh. Where did
Yeah.
you guys end up moving?
We moved to Wichita, and so that's where we're currently at. It's like right in the middle. It's the biggest city in Kansas.
How was that experience moving?
It was good. I found an amazing office that I started working at full time there before I started getting my carpal tunnel symptoms. Full on, yeah.
Yikes.
But an amazing doctor. My husband actually still works for him. I think it was my unicorn office, so it
Yeah.
makes me kind of sad because I'm like, I wish I could have continued it full time, but yeah,
So how long total did you work as a full-time hygienist before you went back to school?
2 years.
Okay, so that was 2 years. Tell me
Mhm.
about your carpal tunnel. When did you realize something was wrong?
So it happened like beginning of 2021 that I started getting like tingling sensations in my hands. Um, and I feel like it got really bad one day when I was shredding chicken by hand.
Oh no.
And then I was like, huh, that's weird. Why are my hands hot and swollen? I didn't really think much of it. I was like, oh, it's just because I shredded chicken. But it just continually got worse to the point where like I couldn't even hold my phone up to like text because it hurt so bad.
Oh
Yeah,
gosh.
yeah, that's when I noticed it got bad.
What did you end up doing about it? Like, do you still experience symptoms or has it gotten better?
So my husband pushed me. He told me to go to physical therapy and just go see what they told me. Like, and I was like, okay, they're gonna tell me nothing's wrong, but fine.
Yeah.
So I went and it was a free consult and he was super kind and he's like, this is like the beginning symptoms of carpal tunnel. And then
Mm,
asked me about my career, my job, and he's like, yeah. So I did like 6 weeks of physical therapy and I didn't work during that time. So I just focused on basically healing,
yeah.
and we did some laser therapy and just did some stuff at home to work
Yeah.
on it. And after that, I went back into just filling in. So that's when I started just doing like temp work,
Okay.
working 3 days a week, and I would do Monday, Wednesday, Friday to give myself like a day of rest
Yeah.
to still continue on my stretches every day and just working on hopefully not getting those symptoms back.
Yeah.
Now it's been, what are we in, 2026? It's been 5 years since then,
Yeah.
and I don't have symptoms anymore at all,
Okay.
which I'm super grateful, super blessed. But it did take a lot of work, and I'm not gonna lie, like during that first year, I still continually had them every now and then,
Uh,
but I had to stay consistent on doing my stretches and all the things I learned in physical therapy.
so what was the moment you realized you wanted to go back to school to become a nurse?
Carpal tunnel did kind of push me in that way because
Yeah.
I started thinking of longevity.
Mm-hmm.
Am I going to be able to work full time? Because, working full time, you do get more money, you see more of the benefits in dental hygiene. So I knew I was not going to be able to do that after just working, filling in and working 3 days a week. Even when I would have worked four, I knew I was pushing myself. So then I've also always enjoyed learning. And I was like, I always was between nursing and dental hygiene school in the first place because of healthcare careers. And I was like, you know what? It wouldn't be a bad idea. I started thinking of it as like, I'm just going to nursing school for fun. I'm adding another extra career and just opening my options. So even if I like failed out of nursing school, I was like, you know what? I still have dental hygiene. It's fine, but it wouldn't be bad to have
Yeah.
another
Couple
career.
extra letters, a couple extra
Yeah,
letters on the name.
there
Whatever.
you
Kind
go.
of cute. Kind of cute.
And I always loved being challenged. I love critical thinking. And I feel like in dental hygiene, I stopped teaching myself and trying to learn. And I don't think I was challenging myself enough too.
Yeah, totally.
which I could always go back and if I was in that position, be like, okay, what can I do to challenge myself? Because now there's other things. There's like injecting, which you can do here in Kansas. So that's pretty cool too. But, I already did nursing. But if I could go back, I think that's what I would have done.
So, how was your experience being a hygienist, working, and then choosing to go back to school?
Yeah, it wasn't hard because I was just temping. And so I didn't have to tell my boss, like, oh my gosh, I have to quit. It was more of like, okay, I'm just going to lower my availability. So during my summers of nursing school, I would fill in full time, which was 4 days max, and just try to save as much money as I could to get me through the semester. And then through the semester, I would just work like 3 days a week. Not 3 days
Okay.
a week. So sorry, 3 days a month.
Okay. Yeah. No, that's awesome. Did you get any scholarships either in hygiene school or nursing school for being a first generation student or anything like that?
So during hygiene school, I paid everything out of pocket.
Okay.
Besides like loans, I did have to take out loans. So that was also hard
Yeah.
because,
Loans.
yeah.
My
So I
gosh.
did have to work part-time at Goodwill during hygiene school. And that was hard because like hygiene school requires so much studying, so much. Like,
Yeah.
this.
Yeah.
It's hard. So navigating that was difficult, but during nursing school, I applied for this scholarship that paid for your whole schooling,
What?
and I qualified for it. Yeah.
That's
Yay.
awesome, dude.
Yeah.
My gosh, that's so cool.
So that like just took off that financial burden
Wow.
and made it so I could just focus on studying, and that was pretty much it. But yeah, all I that was required to get that scholarship was requiring financial aid, obviously. And then you just have to work for in Kansas for 2 years after
Oh,
as a nurse.
perfect.
And I wasn't planning on moving, so
Dang. So,
yeah.
when it came to going to school, did most of your prereqs transfer over or did you have to take extras?
So since it had been over the 5 years, they had expired, unfortunately.
Oh, okay.
So I have to retake like anatomy and
Crap.
physiology, microbiology, those like tough core
Yeah.
science classes. I didn't have to retake those. But I will say that it did help me a lot in nursing school because it was like a big refresher.
Yeah.
And a lot of the things that I learned in A&P and micro retaking it did apply to like the first semester of nursing school. So
Okay.
I was actually appreciative that I did have to retake them, but that did take a whole extra year.
Yeah, that makes sense. I forget that there's like a time limit, which I understand that. I mean, I feel like I haven't
Mhm.
taken those classes in a hot minute. It's been a
Yeah,
while. So,
yeah, yeah.
yeah, well, that's good. When it came to going to nursing school versus hygiene school, how would you compare the two?
So I did attend community college for both hygiene and nursing school,
Oh, great.
community college. So
Yeah.
I think that's why they also had expired. I think if I were to have to go to like a bachelor degree program, maybe they wouldn't have. But at the moment, I was looking at community colleges because I knew they were cheaper.
Yeah.
And I was like, I can manage this cost versus a 4-year degree. And so I think that's why maybe they had expired. But yeah.
No, either way, that's a good tip. Do you have
Mhm.
your bachelor's in nursing? Are you getting it at all?
Yeah, I'm currently working towards it right now. I'm in a 18-month program for it.
Okay.
I graduate in October. Hopefully, fingers crossed, everything goes well. It's an all online school, so I'm able to work full time while I attend school.
And what benefits do you get from that? Like once you're done?
It just opens up more doors.
Okay.
For example, you're not just isolated to working in a hospital. You can work for like a school. My initial thought before like I knew what nursing path I wanted to go to, I wanted to be a school nurse for like elementary school or like high school, and
Yeah.
that way I would have my summers off and then fill in as a
Oh.
hygiene temp. Yeah, that was my original goal. Yeah, yeah.
I mean, it's not a bad idea. So, when it comes to nursing and hygiene school, how would you compare the two?
So with hygiene school, I feel like it was just like harder for me because it was the first time I was attending college and learning rigorous courses, learning how to study because I was used to high school where I could just like memorize a paper and then be fine. Or hygiene is more like application and critical thinking. I was not ready for that. So I think that's why hygiene school hit me harder. And I just had to study way more. So when I went to nursing school, I feel like it came to me much smoother. I already had my studying down. And also, like going to clinicals, I feel like it was much easier talking to patients, just learning that communication is also a thing that you have to learn in hygiene school right off the bat. Because I was very introverted. So I was always like, your day. So I was always very quiet. So I didn't know how to like talk to people. And I'm very thankful for hygiene because in hygiene, we're talking pretty much the whole time.
Yes.
It's like, how are you? What do you do for work? What do you do in the holidays? And so that really got me out of my shell, I feel like. So nursing school, clinicals came to me easier, I think, than most of my classmates where they were barely learning how to communicate with patients and feeling confident.
Yeah, well, honestly, like that, I think that was one of the hardest things for me was communication because you have to be so clear. You have to be so clear and so precise. And that is hard, especially as like a 20-year-old, 21-year-old. Oh my gosh.
Yeah,
Tough.
exactly. Yeah. And when I went to hygiene school, I was 19. So it's like 19.
Oh my gosh. Yeah, babies. This is just your experience, but do you think hygiene school was harder or nursing school was harder?
Hygiene school.
Why?
Just like the clinical aspect. So clinical wise, since I went to community college, they didn't find your own patients. I had to find them all on my own.
Mm-hmm.
And so then trying to get people to come sit in your chair, because if someone's not in your chair, you're missing points for that day. And that's
not good.
That's so stressful in itself. And then boards, I feel it was hard too. Just the fact that we have 2 parts, 3 parts, 4 parts in some states. The clinical versus just like the computerized standard test. Like even thinking about it right now is stressing me out. Going to boards, taking your own patient. I know now after COVID, they finally have like typodonts that you can work on and clean their teeth. So I think that's pretty neat. But I hear that it's still pretty difficult. But I thought that was so unfair. Like, what do you mean?
What do you mean? Yeah, I was like the second class to get the typodont clinical exam. It was really easy. I'm not gonna lie.
Was it? Okay.
Like I mean, it was plastic, so everything was dry, and so you just kind of felt, like the difference feeling between dry calculus and wet calculus. It was nothing was slimy. It was just click click. So it was great. Nice. I was very, very thankful. If I hadn't gotten that, I don't know. It would have been really rough. I applaud everyone who had to do that for like 60 years before. That's crazy. Yeah. Did you have to find a person, I'm guessing?
Yes. Yeah. I had to find, wait, let's see. 1, 2.
A couple. Huh?
I had 3. I had to find 3 because I failed my first 2 clinicals. Okay. Yeah. But okay. I passed my last one with flying colors, so that's all that mattered.
Hey, I failed my restorative one the first time, so I had to retake that one, and then I failed my PSA for my local anesthetic class.
Oh yeah,
I failed my PSA local anesthetic board exam, which was so stupid, but I know exactly what I did wrong, and I felt so like, dude, when I was doing the exam, I put the needle in. And I look at her, and she looks at me, and she's just like, I'm like, oh, man. I was like, I'm going to have to redo this. And it was like $300 for 30 seconds. And it was like, it's fine. I passed. It doesn't matter. But it was so annoying. I was like, whatever, dude.
Yeah, that and feeling. Then the cost
of
taking all these exams and having to retake them is so much.
Oh, my gosh. I know. I don't even know how much I paid. It was like too much.
I think in total I paid like $3,000. Yeah. Maybe 4.
Actually, yeah, I think it was probably close to that too for me. So something I thought was really cool was in nursing school, the NCLEX, you take enough questions and then it stops. Is that right?
Yeah.
Dude. That's so cool.
So you don't have to even take like the full 300 like in hygiene.
Bro.
Oh my gosh.
What are we doing? What are we doing here? That's so cool.
If I could be on that board to change that test, I would.
Like, what the heck? So how do patients treat you as a nurse compared to a hygienist?
I feel like they treat me the same. They're still, since I'm not really working with talking to my patients necessarily because I'm a NICU nurse, so they're babies.
Yeah, they are babies.
I mainly talk to their parents. And so the parents are, most of the time, they're like first time parents or it's their first baby in the NICU. So they're super open to just listening to education, which I feel like is a huge part of dental hygiene is education and reiteration of stuff. And so they're most of the time they're very open to listening. But in hygiene too, you have your patients that are just very stuck in their ways. They don't want to hear what you have to say. They're like, just clean my teeth.
Yeah.
I'm not gonna floss. But all you can do is just educate, show them the risk factors, show them what will happen if they don't. And same thing with the preemie babies. You just tell
Yeah.
them what you're there to do and you're caring for their babies. And it's a big thing, to have their life basically in the care of your hands. They treat me the same as if I were like a dental hygienist.
Yeah. What about
Mhm.
doctors?
Doctors, I feel like would be a little different. I feel like with hygiene, they're very like day to day. You're talking to them, you're collaborating, they're listening to you, you're listening to them, you're making these care plans in hygiene. And then in nursing, you kind of just see them throughout the day. You're not really talking to them 24/7. You only talk to them in the morning when they come assess the patient in the beginning of the day, and then only if there's something wrong. That's pretty
Yeah.
much the only time you're talking to them. So try to catch them when you can, pretty much. They're super
Yeah.
busy. They have to take care of a whole bunch of babies, so I
Yeah.
understand. But yeah.
How do you use your hygiene education within your nursing career and vice versa?
So I think I used it mainly for my education. I have like my little scripts that I would write down and practice for like diagnosing SRP and explaining SRP in terms that they understand because they're like, what's a pocket? And so I think I've started to kind of make my little scripts for preemies too. So like each little diagnosis, I'm starting to make a little script so that way I explain. So I think that's the way I've been using hygiene. And then also when it comes to like the bigger babies that are term babies and feeding them and bottling them, I pay attention to the way that they suck. And I
Yeah.
know this goes into speech therapy. And so they look at like lip ties and stuff like that. So tongue ties. And I've been like super shocked at the amount that doesn't get diagnosed before they leave the hospital. And they don't even find
Oh,
out till they are like first dental appointment.
yeah.
They're like, why hasn't my baby been bottling right? And I wish I could apply it more, but that's when I can't put my hygiene license into my nursing.
Yeah. Well, I'm curious about that. Can you tell me more about that? Like, how do you separate it? How can you use them together legally? Tell me more, because I don't know anything about that. And I know a lot of people out there are probably very curious.
Yeah, so you pretty much can't use it at all, your
Oh,
hygiene license. But whenever like speech therapy's in there, because of course they can do it, I kind of talk to them, ask questions. I'm like, hey, I kind of noticed this. And that's the pretty much the only thing I can say. I can't be like, they have a tongue tie, they have a lip tie, because I can't diagnose, obviously.
right.
But I'm like, he was eating a little weird today. Can you take a look at this? So I try to sneak in there when they go assess the baby.
Do you ever give them like dental tips though? Like, hey, when they're a baby, get a little washcloth and rub their gums. Or do you ever talk to them about bottle, like sleeping with bottle or anything like that? Because that wouldn't
Uh,
cross the line, right? Would that be like,
no, no.
okay, I'm just curious, like what would be and what wouldn't be cross the line? Because don't
So
know.
pretty much the only thing we have like a packet where it has information that we have to tell the parents. And one of the things that is included in there is to not prop the baby's bottle for them going to
Mm,
sleep.
yeah.
But it doesn't necessarily say why. It just says,
Oh,
it says for like choking reasons. So I kind of just add it. I'm like, hey, it also causes cavities because milk has sugar in it that you can't see. Just so like throughout the future, I just tell them in their discharge instructions if I am the nurse that
yeah.
is letting them go home that day. Otherwise than that, in when the preemies are in the incubators, we do oral care. So we have these like little swabs. They look like cotton swabs,
Yeah.
and we put sterile water and we use that to like brush their gums
Yeah.
to prevent thrush. So
That's great.
and we do that every 3 hours.
Oh my gosh. Wow. Oh,
Yeah.
wow. That's amazing. What would be considered crossing the line between the
I
two?
feel like crossing the line would be diagnosing, like I mentioned. Like, I just feel like any oral education besides what we are taught there.
Wow, that's so interesting.
Mhm.
Did not know that at all. Because I
Mhm.
feel like a lot of people think about, oh, I want to go back to nursing school and use my hygiene education, which I think is great. But
Mhm.
yeah, but no one really talks about the
No.
legalities between the two, especially with adults. I mean, do you have any insight on, let's say I'm working with geriatric patients, let's say I'm working with adult patients. What would be a good example of what would be good and what would not be allowed?
So what would be good? They do have toothbrushes. When I was in clinicals, they did make me do. They're like, okay, we're gonna go do oral care on this elderly patient that can't brush his teeth, and I'm like, okay, cool. I'm like, maybe I can use my hygiene. So they're like, here's a toothbrush, here's water, there's toothpaste. I'm like, oh, okay. So I literally just brushed their teeth, but I mean, there was tons of calc layered. So I couldn't even brush his teeth.
Yeah.
And that was so sad to me. I'm like, I even asked my like nurse that I was with, I'm like, is there anything we can do? Can we like get a scaler? Do you guys have anything along those lines? And they're like, no, we're not. We're not
Mm.
legally allowed to touch anything besides a toothbrush.
That makes
So
sense. I mean, technically, as a hygienist, we have to have a dentist on staff anyway. And it would make sense
yeah.
because you're not working there contracted as a hygienist. But when it comes
Mhm.
to giving advice, that's kind of free game, right? Like, hey, patient's family, I'd recommend them see the dentist.
Yeah,
Can you
yeah.
say that? Okay.
And yeah, you can for sure do that, for sure.
Okay. Well, that's a good thing, though, because I feel like that's that communication aspect where it's like, hey, I have all this knowledge, might as well use it. So
Use
that's
it.
actually
Yep.
great.
I feel like there is definitely a bridge that could be connected between
Yeah.
nursing and hygiene, but at this point, I feel like there's just still not enough to do that. Yeah. Just with like hospitals and dental offices, they don't talk yet. And
No.
I wish they did.
Oh my gosh, every day. We have people bring
Mhm.
in their medical insurance every day and we go, nope, that's definitely not right. We don't know why, but that's not right. Sorry, babe. Is
But
it
it's like,
medically necessary?
yes,
Yeah,
it's
but
like
it's not.
dental. It's connected to everything.
Yeah, dental insurance says you can live without teeth.
It's like, no, but
That's
it's
just
like, what about teeth that are infected and then it goes into the bloodstream and
I know, it's ridiculous. So hopefully
it's
one day
frustrating.
I think it would be so cool if I mean in a let's say big dreams here. It would be so cool if you go to hygiene school but it's also a nursing school at the same time. So
Oh,
you can literally do both at the same time. Wouldn't that be so cool? And then you
that'd
can
be
work
so
by
nice.
yourself. You'd also be but then you'd also be a nurse practitioner. So you'd be a nurse practitioner and a hygienist, so an RDH AP, and then you'd also be
NP.
yeah,
Yeah.
dude. I'm
Yeah.
just saying that would be really
That would be
cool.
really cool.
What are we
Yeah.
doing? Like, come on, that's big money right there. We got to talk to the colleges about that because I would totally do that.
Oh,
Can you
yeah, for
imagine?
sure. That'd be
I
so
mean,
nice.
because you could open your own office, you can have nurses and hygienists that you work with, and then you can get your Botox, you can get your teeth clean, and you
There
can
you
get
go.
diagnosed with herpes in the same day. I'm like, come on, dude, what are we doing wrong here? What
No,
is
literally.
happening?
I mean, I feel like it should be like dental is medical.
Oh my gosh. Well, we'll keep advocating for it. I think we should hopefully we'll get there. That'd be awesome. But if you could go back, would you still attend hygiene school knowing what you know today?
I think I would. It really did help me get my foundation in studying and my background knowledge, like I said, to close that gap. Help me get my foundation for educating the underserved. I was able to, educate some families that didn't speak English and teach them about teeth. Taught my whole family about prevention and getting their teeth clean, getting their fillings done. And so just overall health, because your teeth, like I said, are connected to your whole body. So it really does matter. So I don't think I would not go to hygiene school. I appreciate everything that it put me through, and I feel like it made me a stronger nurse, more confident. I'm able to advocate for my patients. I'm not scared to stand up or speak up anymore because before hygiene school, I was.
Are there a lot of nurses that where you work that also speak Spanish, or are you one of the only ones that's able to communicate with multiple? people like that?
Yeah, there's only like 4 or 5 of us on day shift and then a few more on night shift. So there's not many of us.
Yeah.
And since we only work 3 days a week, sometimes there's not a Spanish speaker working. But
Oh,
I will
yeah.
say that their translating devices have improved a lot.
Oh,
So they
wow.
have like a iPad almost, and it's
Yeah.
like movable, so you can take it wherever you want, and it's like video call. So you can just choose the language you want, click on it, and right then and there you have somebody live that's
Whoa.
translating. Yeah,
That's awesome.
24/7.
Oh my
Mm-hmm.
gosh. Well, that's a big help. I mean, I can't imagine not having something like that in a hospital. Is your hospital
Yeah.
pretty big? Would you say since you're in the big city?
Yeah, I think
Yeah.
so. Yeah, I'd
And you
say
said
so.
you work day shift, 12-hour
Mm-hmm.
shifts?
Mm-hmm.
How has that been for you? Like, because before, what was it? It was 12 hours hygiene, but now it's 12 hours nursing. So how has that been, other than your hands, like your mental, your physical, how has that been?
I will say when I started on night shift and that was rough. That was hard. That was so hard. I didn't think it was going to be because I'm a night owl. Like I go to bed at 12 p.m. every night. So I'm like, "Ah, this is gonna be easy." But once 3 a.m. hits, it's like, oh my God, I'm losing my mind.
Oh my gosh.
So it was hard. And then, my husband was on an opposite work schedule, so I never got to see him.
Oh my gosh.
And then I started on in winter time. I never got to see the sun. It just got really depressing.
Sheesh.
But after transitioning to day shift, like, oh my gosh, so nice. So nice. And I always just tell myself, I can do anything for 12 hours. That's what gets me through the shift. There are some days where it's rough. If the baby's not doing well and you're having to do all these interventions and
Yeah.
it makes it a long day, but you get through it and it's really fine. Working weekends too has gotten a little easier. I do get major FOMO though.
Oh yeah, that's so true. Weekends and holidays is something that in hygiene you typically don't have to worry about. So that must have
No,
been kind of new for you too.
yeah, because this was my first year working Christmas, but my family made it up. We just
Uh,
celebrated Christmas on the day after and spent the whole
yeah.
weekend after. I will say it was kind of sad, but my work coworkers make it a great environment.
Uh,
So we try to make it a day, we're all in it together. So we
yeah.
bring our foods, our snacks, and just make it a great day.
Good. Are there any systemic issues in dentistry that make you pull back from wanting to continue being a hygienist?
Yeah, there is systemic issues, I'm sure you know. Not all offices offer 401ks,
Mm-hmm.
paid time off, maternity leave that's paid. I don't
Mm-hmm.
think a lot of them do at all. So I think that's the only thing that would make me not want to go back full time at a hospital if they're going to offer you all those things.
What about
Answer.
the pay? How is the pay different?
The pay is less, but with nursing, there is room for growth. So every year you can still get your, what are they called? They're always increasing your wage every year. And plus, if you do go from nursing to nursing job, you're, and you advocate for yourself, you can get a higher raise and pay with each one.
Okay.
The more years of knowledge that you have, the more that you can do that.
Okay.
Where hygiene, you end up at a cap because of
Yeah.
insurance. We base it
Mm-hmm.
off of insurance, and insurance don't want to raise their prices.
Yeah.
So that's where we run into things like that. But right now, I will say I'm not getting paid hygiene wages,
But you did get
but
benefits, which
I
is
do get the
really great.
benefits.
I mean, honestly, if you factor that in, I mean, it adds up. I really do think
Yeah.
so. Like at my jobs, I used to work for a corporate office and I
Hmm.
got paid this one wage and I got benefits, but then I moved jobs. I lost my benefits, but then I got a $6 raise. So it was
There
kind
you
of
go.
like I did the math and it was like the same. But the thing is, like with no set benefits, I could use that extra money and I could literally put it anywhere I wanted. So like 1 month, if I don't want to put as much into my retirement, I can put it towards a vacation or there are like little benefits, but it was really nice having that like, okay, I have this every single month. This is how it's going to be. So I totally understand how it was probably like, ooh, this is different. Okay.
Yeah, for sure. And I think just for that reason, I wouldn't go back full time, but I will continue to still fill in.
Yeah. How often are
and
you filling
hygiene.
in right now?
Right now, because I'm in school,
Oh,
not
yeah.
very much, but I'm hoping after I graduate, I can start to increase that a little bit more, but maybe like 5 times a year right now, just to also not forget my hygiene
Yeah.
skills that I have and x-rays and educating and stuff like that.
Yeah. So it's kind of like a side gig. You're just like, I got
Yeah,
this other side gig. That's cool.
yeah.
I think that's awesome. So what is your long-term plan when it comes to your career in nursing and hygiene?
I'll start short term first. I just want to first get my bachelor's degree, finish that up. And then long term, I think I just want to take a little break from school because I've
Yeah.
just been on and off from school since I graduated hygiene school in 2019.
Yeah.
And I feel like I just need a little break and then maybe just decide if I want to keep going. But right now, I'm content.
Yeah.
And I think I'm just going to do nursing and hygiene.
Yeah. Do you
Mhm.
want to work in a hospital long term?
I think so. I really do love my career as a NICU nurse. So I'm going to stay there. I'm happy. My coworkers are nice. Management is great. And so I'm going to stay there as long as they want me there.
But this is a hot question I get. So you're actually the perfect person to ask. So I get a lot of questions. Should I go to nursing school? Should I go to hygiene school? If I was that person asking you, what would you just blatantly tell me?
I'd say follow whatever your heart says because ultimately you're going to be the one putting yourself through school. It's whatever you are passionate about. Like the only reason I went to both was because of my circumstances. Yeah, I don't know. That's such a hard answer. I can't make that decision for you. They're both
Mm-hmm.
wonderful careers. Like
Yeah.
I said, they're both going to be financially stable. You're going to have a job no matter what.
Mm-hmm.
It's just about what you see yourself doing for the rest of your life.
Yeah. I tell people to shadow a nurse and then shadow a
Yeah.
hygienist. Ask them, follow people who are doing those careers. If you don't like what one of them's talking about, you're probably not going to want to talk about that all day. I
Yeah.
mean, that's all I have because I've never been to nursing school, but I feel like there's no better way to know what's going on than seeing it and asking, like, what do you do?
Yes.
Like, what do you like doing? You
Mm-hmm.
know?
Yeah, and we do get a ton of students that come shadow in a NICU too. Just going through the clinicals too in school did help me see that I didn't really want to work with adults.
Yeah.
Not saying that that's a bad thing,
No.
but I just saw like the heavy lifting and all that stuff. I'm like, oh no, that's just another problem I'm gonna get into. But there's people who are passionate about it and
Yeah.
they're strong. They got the muscles for it, but when I saw the NICU, I was like, this is where I'm meant to be.
That's so
Yeah.
cool. Oh my gosh. What does your
Yeah.
husband do? Does he work in healthcare too?
He's also a dental hygienist.
No
Yeah.
way.
Yeah.
What? Wait, I
So,
didn't know that. That's so funny. Oh my
yeah, yeah.
gosh.
So we yap a lot, like after work, but like, cause we understand each other. We know the
Yeah.
struggle. Yeah. We actually went to school together. And so that's where we met. Yeah.
What?
Yeah.
Dude, that is
Yeah.
so funny and also so rare. Like, I don't think any male has gone to my dental hygiene school ever.
Oh, it's so funny because I always like joke around. I'm like, he was on The Bachelor, 15 other
He
girls.
was,
He had
though.
to choose who was the one.
That is so funny. Oh my gosh. Okay, so he works full time as a hygienist. So, knowing that your husband's a hygienist, how was his
Mhm.
reaction when you were like, I need to go to school to be a nurse?
He was super understanding. He's like, do it. Like,
Yeah.
it's just 2 years. 2 years are gonna pass by no matter what. Might as well get a degree.
Yeah, might as well.
And we were at the point where we were financially ready for me to do that because we had saved some money.
Yeah.
We're like, it's just gonna work out long term. It's kind of like an investment almost.
Yeah.
So yeah, he was super supportive through it all, and I'm super grateful for him.
Well,
Yeah.
that's super cool because it's also nice because if anything changes or happens, like he's like, "Hey, babe, let me update you on what's going on the hygiene side," and then you're like, "Let me update you on here." I think that's
Yeah.
really cool.
Yeah.
Like, and as we wrap up, what is next for you, and how can my audience connect with you?
What's next for me? I'm just hanging out, gonna go to school, finish my bachelor degree, and continue trying to balance nursing and hygiene. And so if you want to follow along my journey, you can follow me on TikTok. My name is Stephanie Geelan _. But I'm always open to messages about anything. on hygiene, whether that be hygiene, nursing, or just like transitioning in careers, which I don't feel like mine was a career transition. I feel like it was just a career addition.
Yeah, there you go.
Because although like I'm not working full time hygiene, like my heart is still there. Like I truly love it, and that's where my inspiration started for healthcare. So, but yeah, I know it can be difficult trying to navigate through schooling and life. So, if anybody ever has any questions or wants to see more videos about a certain topic, you can always just let me know.
Awesome. Well, thank you so much. Thank you so much for watching, and I'll see you in the next one.